A shocking photo of 4-year-old Jack Willamant Barr with suspected pneumonia lying on an A&E floor. An image few will forget.
Great.
And today, the Health Secretary, Matt Hancock, was scrambled at the last minute to Leeds General Infirmary to deal with this.
I feel terrible for anybody who has to go through that.
Do you apologise to the family?
Yes, of course. And to anybody who gets service from the NHS that isn't up to the standard that they should expect.
All the main political parties are promising more money for England's NHS, but it's needed now. Already delays in treatment and staff shortages are at record levels. And now a Channel 4 News investigation shows just how stark the risks are to patient care.
Today we've run out of beds in the hospital. So at the moment there are patients waiting long periods of time for a bed into the hospital. And because there is now no room in the A&E department, ambulances start queuing out of the front door.
This senior doctor had just come off shift on Saturday when we spoke to her, anonymously, because she was worried about reprisals from her trust.
Most departments are probably working in situations which are unsafe on a fairly regular basis. My concern is that it's impacting on patient care. If you don't have enough staff to see and treat patients in a timely manner, then you're not going to notice deterioration. Things will happen later, perhaps drugs given later than they are meant to be. At times they can provide good care, but there are also times when they can't provide OK care. It is substandard care, and that adds to their stress because they know that.
Today, the Royal College of Emergency Medicine said that in the first week of December, over 5,000 patients waited for longer than 12 hours in the emergency departments of 50 trusts and boards across the UK. The challenges are not just in A&E, although that is where it's most visible. Channel 4 News has examined what is happening in England's NHS by looking at how trust boards rate their own risks. So this is the health service, in its own words. The latest board papers available from 92 acute NHS trusts show that 65 had at least one risk where they said it was likely to happen and would have a severe impact. They give this the highest scores of between 20 and 25. And 14 of those trusts showed the maximum, that is 25 out of 25, meaning potentially catastrophic results. The most common themes: funding, staff shortages, waiting times for cancer, fire safety, and old hospital buildings becoming dangerous. As an example, Queen's Hospital, part of Barking and Havering Trust, they listed a number of severe risks. What's happening here isn't isolated. You can see that from our research. So when we looked at their latest board papers, we could see they'd set the highest risk, that's 25, for things like capital funding, building works. For their deficit, they're running at a loss. They've even said that they can't find a way to make savings while maintaining quality of care. In other words, if they are to maintain patient safety, something has to give. But looking elsewhere, Nuneaton, the trust gives the maximum risk rating for
patient flow within urgent care not being managed effectively due to a lack of adequate processes and systems, resulting in potential for delayed treatment and patient harm.
In Leicester, a major risk of
failure to deliver key performance standards for emergency, planned and cancer care.
And there's a significant risk at Wirral Hospital Trust of a
catastrophic failure in standards of safety and care.
Barking, Havering and Redbridge Trust told us that they have now secured a £9 million capital funding loan from the government, and they do want to make sustainable savings, but that this takes time. And all the trusts we've mentioned here say they have plans to address and mitigate the risks we identified. And some say those risks are the potential worst-case scenario.
I think what we're seeing with these board papers and these really high risk ratings is that it demonstrates the level of pressure that NHS trusts are under at the moment. So they're really facing workforce pressures, so a shortage of staff illness. They're facing demand pressures, so many more people coming through the door. And they're also facing the imminent Brexit issue. So that's looming, and whenever a trust is assessing risk, that's going to be high up there.
Jack is home now, but he spent 4.5 hours waiting in A&E last Tuesday, then 5 hours on a trolley before finally getting a bed. His mother posting this picture in despair.